Endometrial hyperplasia is a condition of abnormal thickening of the innermost lining of the uterus, the endometrium, which thickens and bleeds in each menstrual cycle. Often an abnormal growth of the endometrium leads to bulky uterus, severe pelvic pain, problems related to conceiving and miscarriage, and also heavy periods in a large number of women. Endometrial hyperplasia can be caused by a number of factors related to poor diet, lifestyle, hormonal imbalance, lifestyle stages, and even genetics. Now, some of the common treatments offered to women with endometrial hyperplasia are related to hormonal birth control pills or invasive procedures like hysterectomy involving complete removal of the uterus. However, these treatment approaches not only not address the root cause of the problem but also lead to a lot of side effects. For example, in hysterectomy or complete removal of the uterus, a woman cannot get pregnant anymore. Ayurvedic treatment, on the other hand, involves a holistic and natural approach that helps you to resolve uterus disorders such as endometrial hyperplasia at the root cause level with the help of herbs, diet, lifestyle, and yoga. Hi, this is Nidhi Bansal here from Medhya Herbals. We help women to gain health with all natural and holistic principles of Ayurveda, and in this video, I will share with you highly effective Ayurvedic natural ways to resolve a condition as abnormal thickening of the uterus or the endometrium, which is causing all the problematic symptoms that you are going through. Let's get started. Endometrial hyperplasia occurs when there is an overgrowth of the endometrial tissues which have the same characteristic as the uterine lining, or when the uterine lining becomes abnormally thick. This can be caused by a variety of factors involving excessive estrogen or estrogen dominance, or even factors related to diet and lifestyle, or it may appear as a condition secondary to other medical conditions. Endometrial growths are typically not cancerous. These are simply the extra tissues which have grown out of their normal place. And as I said, these tissues have similar behavior to the uterine lining. That means they grow and bleed each month under the action of female reproductive hormones as estrogen and progesterone. But since these tissues are growing out of the place, the menstrual blood released by these tissues is kind of trapped inside the uterine lining. That's why they can create a lot of inflammation, scarring, pain, and severe discomfort during periods or after the periods due to buildup of this menstrual blood and hence the scarring. Endometrial hyperplasia is a common problem among women of reproductive age. It can lead to irregular menstrual bleeding or heavy menstrual bleeding, and in large number of cases it also leads to problems related to infertility. The abnormal growth of the endometrial tissues, as in endometrial hyperplasia, can be characterized by the type of the cells that are growing, whether they are cancerous or not cancerous, and also by the extent, the location, and the density of the growth of these cells. For example, if you have too many of these cells or the uterine lining is too thick, yet it doesn't contain any abnormal or cancerous cells, then it's still considered a benign condition which can be resolved. However, in case of absence of treatment, even this benign condition can turn to cancerous, and research states that as many as 1 in every 3 women is prone to developing endometrial cancer as a result of untreated endometrial hyperplasia. That's why it is really important to address the condition in the right time and thus prevent it from growing abnormally any further. Endometrial hyperplasia can often be asymptomatic. That means there may be no symptoms at all. However, in a large number of cases, women experience severe pelvic pain, cramping, and discomfort before and during your menstrual periods, heavy menstrual bleeding, short menstrual cycles, irregular menstrual cycles, or dysfunctional uterine bleeding, prolonged menstruation, passage of blood clots that vary in size, may be as big as a golf-sized ball during your menstruation, problems related to fertility, frequent miscarriages, and also inability to conceive. Some women also experience abnormal vaginal discharge, which is thick and heavy in nature, pain in the lower back, weakness, fatigue, shortness of breath, weight gain, obesity, and inability to lose weight, severe digestive issues related to constipation, indigestion, gas, and acidity. In Ayurveda, endometrial hyperplasia can be compared to yoni vyapad, which means disorders of the reproductive system, and in addition, when there is heavy menstrual bleeding involved, it can also be compared to asrik dara, which literally translates to uncontrolled menstrual bleeding. Now, Vata dosh plays a primary role in the functions of the reproductive system and specifically of the pelvic area and of the eliminatory functions of the body. That's why any disturbance in the Vata dosh, specifically the Apan Vayu, which is a sub-dosh of Vata dosh, which actually flows downwards, can lead to abnormal growth of the endometrium and also abnormal bleeding, as is commonly observed in abnormal growth of the endometrium. In addition, presence of Pitta dosha and Kapha dosha may complicate the situation further, thus leading to extensive inflammation, acidity of the blood, and also excessive growth, which may push the condition further to the case of endometrial cancer. Ayurvedic treatment for endometrial hyperplasia involves a holistic approach. It's a step-by-step treatment involving herbal medications, diet, and lifestyle changes, which help you to overcome the current inflammation and also balance the dosha and tone up the reproductive system so that the condition doesn't recur. So the first step is to detox the body to get rid of the excess hormones, excessive toxins build up in the body which are creating inflammation and buildup of the uterine lining. The second step is to balance the Apan Vayu, help it to flow downward in its natural way with the help of yogic breathing exercises, yoga asana, as well as herbal regimen which will support its natural and regular flow. The third thing will be to restore the hormone balance, fertility, and regular ovulation in women. The fourth step will be to arrest the excessive menstrual bleeding with the help of astringent herbs and foods which will support normal clotting of the blood and hence prevent prolonged menstruation or excessive bleeding, which is happening in your case. The fifth step will be to promote circulation in the pelvic area so as to prevent the buildup of the toxins and any clogging and blockades which are preventing regular flow of the Vata dosh. The sixth step will be balanced nutrition and also lot of self-care which helps you to balance your hormones and overcome the inflammation and extensive stress which you are currently going through. Now here are some Ayurvedic herbs which are really effective in achieving all of these steps in a systematic way. Do note that Ayurvedic herbs are potent medications which need to be taken under the guidance of an experienced Ayurvedic doctor who can guide you specific use of the herbs according to your health status and health requirements. In addition, Ayurvedic doctor will also guide you with specific foods and lifestyle choices which you can take to bring your body back to balance. Now let's look into these specifics so that you can start putting your health back on track. So the first step will be to adopt a Vata Pitta pacifying diet involving naturally sweet tasting foods such as whole grains, beans, lentils, leafy greens, fruits, and lot of vegetables. These foods not only help you to balance the hormones but they also contain vital nutrients and antioxidants which prevent the inflammation in the body and also help you to detox in a natural way. The second thing will be to avoid all bad foods which are creating a lot of inflammation and buildup of estrogen in the body. These foods are also leading to accumulation of bad fats and hence obesity and inability to lose weight. So do make sure to avoid all processed foods, sugar, white flour, excessive amount of chili, caffeine, alcohol and smoking. All of these are not only creating a situation where you are building up excess estrogen and hence excessive thickness of your uterine lining, but they are also blocking the effect of any helpful measures that you are currently trying to take to bring your health back on track. The third step will be to wear loose clothing, especially in the lower area of your body, so that there is proper circulation in the pelvic area and hence you can prevent blockage and buildup of toxins in the area. In addition, you can carry out specific yoga asana which help you to promote circulation in the area in an active way. And here is a list of yoga asana that you can perform which will not only help you with endometrial hyperplasia but also help your hormones come back to balance. The fourth step will be to get sufficient sleep and rest. It will help you to bring your hormones back to balance and also prevent additional fatigue which is further aggravating your condition. The fifth step will be to stay calm and relaxed and prevent any stressful situation. It involves active management of stress, being aware of the factors that are pushing your mental balance off. This is because when you are stressed, your body releases cortisol, a hormone which further disturbs the functioning of estrogen, and it really leads to a suppression of all the body functions involving immune system, reproductive system, hence your fertility as well as your digestion, thus leading to poor digestive symptoms that you are currently going through. When you are actively managing stress by staying relaxed, by engaging in those activities which calm you down, you are also bringing your hormones back to balance and preventing the buildup of excessive cortisol in your body. It really gives you a chance to recover and replenish from this current situation in which you are. So that was all. I hope you found it useful. Do write to me for any comments and feedback. I will get back to you. Do subscribe to Medhya Herbals channel so that you stay updated with latest health tips that I post here, and do like and share this video with all who will find it useful. I will see you soon in the next video. Until then, bye.